Now, an Emeritus Newsbrief, I'm Lynn Houston. The U.S. government faces a tough job trying to convince the American people that the swine flu outbreak is serious while not causing a panic. World Health Organization Director General Margaret Chan announced that a swine flu pandemic is imminent.
Must be taken seriously precisely because of their capacity to spread rapidly to every country in the world. All countries should immediately now activate their pandemic preparedness plans. Countries should remain on high alert for unusual outbreaks of influenza-like illness and severe pneumonia. At this stage, effective and essential measures include heightened surveillance, early detection and treatment of cases, and infection control in all health facilities. I have reached out to companies manufacturing antiviral drugs to assess capacity and all options for ramping up production. I have also reached out to influenza vaccine manufacturers that can contribute to the production of a pandemic vaccine. After all, it really is all of humanity that is under threat during a pandemic.
But understand that because this is a new strain, we have to be cautious. If this was a strain that we were familiar with, then we might have to, then I think we wouldn't see the kind of alert levels that we're seeing, for example, with the World Health Organization.
In the U.S., officials were explaining the death of a nearly 2-year-old Mexican toddler who died in a hospital in Houston.
It's important for everyone to know that while the death occurred here in Houston, this unfortunate child was not a native Houstonian. This child is a resident of Mexico who traveled to Brownsville, Texas to visit family. It was there in Brownsville where the child first became ill, was taken to a hospital on April the 13th and was admitted to the hospital in Brownsville. The patient became quite ill rather rapidly and was transferred the next day to a hospital here in Houston. And as you know, unfortunately, in spite of the best efforts, the child succumbed to the illness, and the CDC provided us laboratory confirmation, which they announced this morning, that the child was in fact infected with the swine flu virus.
Officials say more deaths in the U.S. are likely and that more flu medications have been sent to health centers throughout the country. On Capitol Hill, Congress passes a $3.4 trillion budget. It contains a provision to change congressional voting rules. If a health reform bill is not passed by October 15th, supporters will only need a simple majority to pass it, thereby avoiding a potential filibuster. The latest on the biggest issues in public policy only at emeritusnews.com and the Emeritus News channel on Mogulus. That's an Emeritus News Brief. I'm Lynn Houston.